Good evening, everyone. I'm Dr. Richard Ferguson, President and founder of Black Physicians of Utah. And this evening, in recognition of Colorectal Cancer Awareness Month, which occurs in March, we'll briefly be presenting and discussing on the significance and the importance for getting screened for colorectal cancer. It impacts our people, particularly that of Black Americans, significantly. As you can see here, these are two famous actors that were impacted at such that we lost far too soon on colorectal cancer. Colorectal cancer is a cancer that can be prevented and progression of it can be stopped. So colorectal cancer, as I stated just a second ago, you can't prevent it. So in the United States, it's actually the third most common cancer in both men and women. Many people don't often think about that. People think sometimes about skin cancers. They sometimes think about lung cancer, but actually this is quite common. Given how common it is actually is fairly preventable with many of the screening methods that are available today, as well as the direct visualization screening method, and that is with a colonoscopy. But regular screening is for removal of growths, particularly polyps, that can eventually develop into a colorectal cancer. So what common cancers can you prevent with screening? I think some people may come to mind. You may think breast, you may think prostate, but actually when those are not good at actually screening for cancer, they can actually detect when cancer occurs, and you may be able to get earlier treatment, but it actually doesn't detect anything in a precancerous state. There's not a precancerous form of prostate cancer. There's not a precancerous form of breast cancer. So why is colorectal cancer screening important? Well, you can prevent, not just detect. Colorectal cancer is a form of screening test. Removing those precancerous growths, once again, those polyps, reduces the risk of colorectal cancer. Why is colorectal cancer screening important? Well, there's the power of prevention. Where does colorectal cancer tend to occur? Well, we'll do a brief dive into anatomy here, but this is a picture of our large bowel or large intestine, and this represents our colon and our rectum. Colon cancer can occur at any point through that, and that is where screening, and particularly through fecal occult blood testing, but as well with colonoscopy. Now, what do these polyps and what does the cancer look like? Well, colorectal cancer usually starts as a benign growth, as you can see on the left side of the image here. You get this sort of smoothing or a little bit of a bump, what we call a hyperproliferation. Then it goes from this hyperproliferation to being a little bit of a smaller polyp. Then it becomes a larger polyp. And then as it progresses from that, you're still in a benign state. And then it becomes a severe dysplastic polyp. So this precancerous polyp, if progressed, can progress into adenocarcinoma. So the key is that with regular screening, at least every year for fecal occult testing, and then having based on your risk factors, a colonoscopy every 5 to 10 years based on one's risk factors from the prior colonoscopy, starting at the age of 45. And this is even if you're asymptomatic. We'll go into symptoms here in a second. You can prevent that progression from the hyperproliferation point to the severe dysplasia. If you are able to lob it off at that time, you can actually stop the development of cancer. You could be free for years before needing to be rechecked again. If you're clear, you've been able to present yourself from possibly dying of the third most deadly cancer in the US. About colon polyps. Not all polyps turn into cancer, as I just stated, but all cancers start as polyps. So that's the key. And I'll start showing a few photos of polyps in the next slide. And once again, remember, screening by colonoscopy with polyp removal prevents colorectal cancer before it can start. Here, polyps come in many different shapes and sizes. And this is all in the large intestine that you're seeing here. So colonoscopy is the only screening test that allows both identification and removal of polyps. The removal of polyps is a polypectomy. Colonoscopy, so you can see a before and after what happens when you remove the polyp. A camera goes in that also is able to slide out and either burn or remove polyps through the same device that's being used for evaluation and diagnosis. And so that's the colonoscopy or surgical scope that goes in through the rectum and goes through your large colon. Who is at risk for colorectal cancer? Colorectal cancer affects both men and women. 1 in 23 lifetime risk for colorectal cancer for men and 1 in 25 for women. And due to our changes in diet, increasing percentage of the population with obesity, these risk factors and our sedentary lifestyle has caused actually colon cancer risk to increase 4 times higher than that of people that were born around 1950. So I wouldn't be too surprised if they lower it to 5 years and say when you hit 45, that's when you get your colonoscopy. Right now it's for average risk and African Americans because often there is a access to care that affects sometimes our ability to have insurance access and thus being able to receive a colonoscopy for screening purposes. Factors that further increase risk: family history of colorectal cancer, smoking, obesity, physical inactivity, abdominal radiation, ulcerative colitis or an inflammatory bowel disease, and being African American. What are symptoms of colorectal cancer? Most early colorectal cancers produce no symptoms at all. This is why it's so important to get screened. Never ignore or new or worrying symptoms, and that can be with abdominal pain, but often most providers, most physicians will tell you to focus on if you're having change, if your weight loss is a little bit of more of a late symptom, but more so if you're starting to have blood in your stool. So do not wait until you get symptoms to get checked for CRC or colorectal cancer. Abdominal pain can be a presenting factor. Unexpected weight loss, as I just alluded to. Unexplained or new anemia. Blood in the stool. Change in bowel habits. Change in the shape and size of the stool. And rectal pain. So, what should you do differently if you have symptoms of CRC? Get screened. And I'm going to go into the ways you can get screened next. Screening means getting checked even when you have no symptoms. So screening and colorectal cancer. So there's step 1 screening versus 2-step screening for CRC. Step 1 is a colonoscopy. It's the one test where that looks for growths, once again called polyps. It looks through your entire large intestine, from the rectum all the way through with a colonoscoscope. This colonoscopy is probably the most commonly performed procedure in the U.S. 2-step screening. So this is a test first to detect blood or altered DNA in the stool. A positive result would then lead to the second step, which is the colonoscopy. So this is where you can get a test, as I see here, the FIT test. So this is a fecal immunochemical test to detect hidden blood in the stool. The stool FIT test is typically performed on an annual basis, so you would do this every year. A positive test requires eventually following up for a colonoscopy. So you can take several of those, say even prior to 45, you're negative, and then one pops positive, you trigger colonoscopy. Or you start at 45 just with your colonoscopy, or let's say 50 in this case if you're not African American. In that meantime, you're taking a FIT test every year. And then there's multi-target stool DNA. So this is your Cologuard. So this is a non-invasive screening that looks for abnormal DNA that's typically associated with precancerous polyps. So that's the dysplastic ones I showed you earlier, and then colon cancer. So it's more sensitive than the FIT test, but your chance of getting a false positive here is quite may increase with advancing age. So that's something that one has to consider. So there are actually though other steps, alternative step 1s that test for individuals who cannot or will not have a colonoscopy or won't get a FIT test, and that's a CT colonography and a colon capsule. So this time that will depend on what city you live in and if your insurance will cover these, sometimes often much pricier examinations. So a CT colonography and colon capsule, they CT colonography is a way that you have radiographic imaging. Probably the best way to describe it would be a radiographic substance that is able to model and show the appearance of a polyp on CT. And then you have direct visualization by essentially swallowing a small pill that has a camera in it, and then it goes all the way through your GI tract looking for polyps. So if you do step one, if you do a one-step test, which is colonoscopy, or a two-step test, which is your FIT or your flex sigmoid or your CT colonography. So these are the screening recommendations from the American College of Gastroenterology. This is the primary subspecialty gastroenterologists that do the lion's share. Mind you, some general surgeons can do colonoscopies, and even some family medicine physicians can do colonoscopy, and some internists, but generally gastroenterology. And so it's recommended colorectal cancer screening in average risk individuals between age 45 and 75 occurs to reduce precancerous growths. So we want to stop those polyps from becoming advanced adenomas and eventually progressing into colorectal cancer. They recommend that colonoscopy and the FIT are the primary methods of colorectal cancer screening. Often I say yes, start with the colonoscopy and interim with FIT tests or the multi-targeted stool DNA tests. And we suggest, the gastroenterologists suggest that the decision to continue screening beyond age 75. So if they were maybe a heavy smoker and they stopped 20 years ago and their last colonoscopy might have been negative, then that's where they can say, well, let's do one more in 5 years and then call it quits. So the recommended frequency for different screening tests: colonoscopy every 10 years, a FIT every year. And remember also the Cologuard. So African Americans are diagnosed with colorectal cancer at a younger age, and African Americans with colorectal cancer have decreased survival from colorectal cancer because it's often diagnosed later due to sometimes having lack of access to care and lack of access to health insurance and other social determinants of health that impair that continued health inequities that make it difficult sometimes for African Americans to not only get screened, be aware of screening, trust screening, but also to know what to do when they have positive screening results due to sometimes fear of treatment. There will not be that next step, which is definitively getting a colonoscopy. So American College of Gastroenterology recommends since 2021 colorectal cancer screening for African Americans starting at age 45, just because of our increased risk, and particularly for Black men. That will end our discussion and overview this evening of the importance of colorectal cancer screening, particularly in the Black population, but for everyone. It's March. Take this time now to schedule to get your FIT tests, pick up your Cologuard, or to go and schedule for your colonoscopy. And once again, if you want to find a gastroenterologist near you, go to gi.org/patient/find-a-gastroenterologist. It'll actually take you to the site where you just put in your zip code or your street address, and it'll give a whole list of them. And there actually is a Black gastroenterologist in the Salt Lake area called Peter Fenton with Utah Gastroenterology. And I will have his address and number within the comment section in the notes as you view this on YouTube and off of our website.